Good morning, good evening, greetings, salutations. What a great venue we've got today. Uh, we move through this critical near miss on a ward. Yeah, yeah. Just take a seat. Yeah, and we'll get started. Uh, Pressures and expectations surround you every time you touch a bag of fluid or a balance chart. The clear bag you hung, the chart you didn't have time to fill out, uh, the story on the ward that no one helped you read might have pushed someone's body closer to the edge than anyone realized. It's a pretty startling place to be, but I want you to feel the seriousness of this without dismissing an opportunity to hone your clinical reasoning and skills. Fluids are often sold as very basic, something you should master in first year. Hang the hang the bag, press start, tick the chart, done. But in reality, real people have hearts, kidneys, blood pressure that's already under strain. And so there's nothing basic about pouring liters of fluid into an already fragile system and then just letting it ride. In this episode, I want to show you a near miss, and I want to use it as a diagnostic entry point for this topic of fluids. It's not a diagnosis of whether or not you're ready to hang an IV, whether you're ready or not to tick a box, but it's a diagnosis of the pressures and the expectations that surround you whenever you touch a bag and whenever you balance that chart. Imagine this shift, and I'll come at this as if I'm a patient. I'm a frequent flyer. I know what it's like to be a patient. Uh, and we'll go through and see how, as a lecturer and as a patient, we can look at this event of a near miss and really break it down to establish how important fluids really are. You imagine this, you're on shift, evening shift, you're on the ward, you have your preceptor, budgets at the hospital or clinic where you work are not the highest. And so you already have an overload of patient to preceptor ratio. Uh, for now, let's talk about three patients that you've got just directly around you. You have a middle-aged man, he's got pneumonia, he needs antibiotics, and he needs oxygen. One is a woman with poorly controlled diabetes, and she's nauseated. She's on an IV because she's not eating. Uh, Third, you have an older patient, heart failure, chronic kidney disease, admitted with increased breathlessness. And on the paper, you would think, right, very straightforward, very simple. Give the antibiotics, check the sugars, hang the prescribed fluids, fill in the chart, keep an eye on the obs. In reality, you're running the whole time. A buzzer goes off, a family member catches you in the corridor, the doctor wants an ECG, someone needs pain relief. You're going to try and be polite, you're going to be thorough, and you're going to try and be safe all at the same time. On this shift, however, we're going to look at what that near miss takes, what that near miss looks like, and then we're going to start to take it apart as we move through it. The heart failure patient is charted IV fluids 1 liter over 8 hours. Repeat as needed, plus oral intake as tolerated. Uh, Heart failure patient's a bit dry, according to the admitting team, and someone's written gentle fluids in the notes. You figure out what gentle fluids means. Good luck. You hang the bag. You sign the chart. You're relieved, right? That's one thing done. And you're going to come back later. What are you going to come back later for? For a minute there, I had to actually figure it out myself. You're going to come back. You want to check the ins and outs, right? You want to go and see how much more fluids have gone in, how much the urine output is. But all of a sudden, 4 hours gone. You've been just whisked around, moving around to and fro. By the time you get the next real solid visit into the room, heart failure patient has extra pillow under their head. They look quite short of breath, more so than earlier. Their ankles are more swollen, and when you check their obs, the oxygen requirement has crept up. You can tell. yourself many things. You could say, "Oh, that's an infection," or it's the heart failure that's doing this, and you're going to go ahead and mention it at handover. And what can you do, right? The doctor's nowhere in sight. So 2 in the morning comes along. There's a Met call, increasing breathlessness, crackles, hypertension, low oxygen sats. The heart failure patient is struggling, and now suddenly everyone is very interested in their fluid balance. How did it change from being such a nice, easy, simple thing to now being very concerned about fluids? Next day, you see the chart. 3 bags of fluids in 24 hours, right? 1 liter every 8. Oral intake, estimated, but not measured. So now you've got to consider I've got 3 liters plus some amount. Urine has been written down as 2 times, but no actual volumes. Daily weight, there was one that was actually missed, and that's because the scales were out of the room when you needed them. When someone finally adds up the totals, the balance is actually several liters in the positive. Now, we're talking about older heart failure. We might think that for a healthy 20-year-old on a hot day, they might be annoyed if they're positive balance like this. But for a 75-year-old, failing heart, kidneys that are already struggling to clear fluid, it's dangerous. This is what I mean when I say that just fluids becomes a reason for patient crashes. It's not because anyone was reckless about it, but because of these small, systematic, understandable actions and omissions, they get added up. And all of a sudden, there's this giant pressure placed on the heart, on the kidneys, and circulation. So just think about that for a moment again in this near miss scenario. How would you feel? All of a sudden, you were there on the ward, you put the bag on, you ticked it. You see how much trouble this patient is having and how the noted information is not completely making sense. You can turn it all inward, decide that you're not cut out to be a nurse. Please don't do that. Uh, you should already be an expert at fluids. Well, again, fluids are often given as a basic part, but they're not basic. So you got to learn. It's also very tempting to lash out. Why didn't anyone stop me from giving all these fluids? Well, there's a reason that the learning curve feels hard. Fluids are treated as very low level, and yet it's in a very high risk context. And you don't have, when you start, you don't have your system set up. There are systems that come with time, experience, amazing mentors. Those take time. So as you start to build your system to work with fluids, you'll begin to see that that overwhelming feeling which can develop, you'll begin to stabilize and be able to say, okay, rather than reviewing a near miss, you're going to be able to say, look, part of my training is in rostered supervising roles where those in charge of me are already overloaded. That's how I've got to learn. I'm going to do this and I'll put the proper systems in chase to do it. So let's go back now to this near miss. You saw the extra pillow under the head, slightly more labored breathing, ankles more puffy. Urine bottle didn't look particularly full. So automatically you're thinking, well, I know how much is going in. Not a lot looks like it's coming out. Um, Maybe you haven't had a long time to scrutinize the chart. These, though, should already be telling you there's a fluid overload here. If someone's being propped up, they need to breathe easier, their lungs are under pressure, perhaps it's fluid building up. If you see that their ankles are swelling, if you see that the urine output, all of a sudden, these are going to start telling you there's an imbalance here. So it's not dramatic in the moment, but it's dramatic over the time it's taking to build up. Uh, what can you do in that scenario? Well, you will learn and start to see that patients with heart failure and kidney disease often look a bit puffed up and a bit swollen. But please remember, under the surface, in between those cells, every extra milliliter you give is asking the heart to pump more against a greater volume, asking the lungs to cope with more fluid around them, and asking the kidneys to clear more than they can already handle. Just small amounts add up. Crackles at the base need more oxygen. right? Those are already going to be inferred. Waking up breathless in the night, if the patient's been noted as doing so, perhaps a couple of kilograms of weight have been gained over a few days. Well, clearly you can now put two and two together on this one, why the urinary output has decreased, the water is being, or the fluids are being retained, right? That's going to increase blood pressure, and that pounding pulse suddenly drops when the heart starts to tire. So all of a sudden, fluids become very relevant from something that was thought to be hanging a bag and ticking a chart. Uh, so many of these events, so many of these items that you'll pick up and learn and see and place within your systems are a way of the body saying, excuse me, there's too much fluid in here, and the organs are really having a tough time. I don't want to go into the biochemistry in full detail yet, but you can start to see that there's a pattern here. Fluids are not an add-on. They're the core of how circulation, the heart, the kidneys, they all share that workload. And when you pour in more fluid, you're going to raise the pressure in a closed system. If the pump is weak or if it's stiff, it gets overwhelmed. And yes, by pump, I mean the heart. If the filters in the kidneys are damaged, they cannot clear the load, so the body holds on to fluid in places it was never meant to stay. Hence the ankles, the lungs, the abdomen, even the brain. That's why we say that poor fluid management worsens heart disease, kidney disease, and metabolic conditions like diabetes. Hence, you can see the examples that we're looking at. Now, it's not an abstract warning in this scenario. It's a direct relationship behind one more bag of fluid to, hey, this heart is drowning in volume. These kidneys are not going to be able to handle the pressure that's happening here, and we're going to risk having them fail. So let's talk about the chart and that piece of paper or the electronic screen where the whole story is meant to be visible. Should be able to pick it up. The chart knew the truth before anyone else did, even with gentle fluids being written down. It knew that more fluid was going in than was coming out. It knew that there had been a weight gain. It knew that some entries were missing and that the totals hadn't been calculated. The charts are there, and yet how well are they being used? They're on the clipboard, they're on your computer, they have been recording what's there. They've got to withstand handovers. They've got to withstand movements, hustles, and bustles. So on a busy shift, it's really easy to treat them as an annoying piece of paperwork, but they are actually a live signal of how much strain is on a patient's circulation and how much is straining all around them in their organs. Anyone ever come up with the idea that you'll just fill in charts at the end of a shift when it's a little bit easier, a little bit more relaxed, when there's more time? Again, if you're overstaffed, you're having to move between several patients at once, there's a perhaps thought. Maybe, please don't copy yesterday's totals because you figure, hey, they might be the same. Don't know whether a small or a large instead of the volumes in the bottle, but these are all responses to the stress of the workplace and wanting to be able to appear and be uh, prepared and ready to do your job. I want to bring in another core objective of what we look at, and that's that the work is difficult. Fatigue is going to set in. Being so busy and overloaded with tasks. This is a cause and an identified risk for errors in fluid documentation. I think someone could have written more than gentle fluids so that the amount could be passed along and so that a correct total could be added up. But again, how are you going to meet high demand, high busyness, high fatigue, task overload, and fill in the chart at the same time? This is where your systems come in place. Please take time to learn from the mentors that are there on the ward who just have it down pat. Watch them, study them, learn from them. Uh, that way, you become safer and you don't have to just face the pressure head on, you have a system to combat it. Now, you become safer by doing this because pressure is going to distort your attention, your memory, and your priorities. But if you map out how you'll handle the situations, that will help you see it through. And as you learn your critical thinking skills on the run, rather than just sitting in a tutorial, you'll be able to feel more confident in your skills. Build those small systems is the key message here. They'll protect you and they'll protect your patients. In other words, when we talk about pressure dynamics, yes, it can be the pressure on the ward. Yes, it could be the pressure in your own mind. Yes, it could be the pressure to succeed because you're representing your family, your community. Uh, you have so much on your shoulders. Don't let that pressure scare you to take shortcuts or to missteps that are critical to those that you're looking after. Um, here's the uncomfortable part of this, and I'm going to pair it up with a hopeful part as well. Fluids are powerful, and I think that that cannot be understated. The uncomfortable part is that they are powerful, and you have to realize that just hanging a bag has so much to do with an individual's well-being. Now, to feel comfortable about that, you're going to have to get to a certain place where knowing that a liter here and there is the difference between a stable patient and a deterioration call, particularly if hearts and kidneys are already fragile. So you can see that it's a fine line you walk. Uh, one of the things that you'll see is that learning to understand early on signs that are associated with fluid balance, whether it's ins or outs, and how they'll be calculated, you'll know how to treat the chart much better so that should anyone else come and follow right behind you, the patient will be receiving the care that you yourself or I would like to be receiving at that time as well. So don't treat the chart as a chore. Uh, Treat it as the valuable information that it is. Go ahead and learn how to question a repeat fluid order before it's hung on a heart failure patient with rising weight and crackles. You can notice that when a diabetic patient is on fluids because they're not eating, also has rising blood pressure, a growing positive balance that no one's added up. You can use your observations and your documentation to actively protect your patients, even when the system is pushing you to rush. If the pressure is high, you'll still be able to do it. So as we look at this right now, where does this leave us? I want you to be thinking this is complex for reasons that make sense. There's a reason that fluids feel hard, even though you may have gone in or been told that, hey, fluids are just a basic part of what you're doing. Understand that they are quite complex, and there's a reason for that. Uh, it, it's it's complex because the dynamics of being on the ward in real life situations is always going to trump what you read or what you see or hear in a lecture. What you'll begin to do is synthesize a clear and practical understanding of fluids, heart, blood pressure, kidneys, and how they all interact. Not to forget the lungs, of course. Now, this is going to show you in reality how your assessments and your charts actually can change a story from a near miss to a never miss. In the next episode, we're going to pick up some more about this near miss. We're going to pick it apart a bit more. We're going to map out exactly what the ward was asking your brain to do in the moment, and we'll look at how many decisions and assumptions are wrapped up in the phrase, just hang the fluids and fill in the chart. It's a very heavy task for anyone, uh, especially if you're a student and a newbie. Okay, so hold on to this. Fluids are powerful. The system is full on pressure. You're allowed to feel overwhelmed. And from here, we're going to build understanding that lets you work through that overwhelm step by step.